Curie score is a tool. It's a model. Hmm, It's for every parent listening, I would say this. It's not the only factor that should be used in considering if transplant should be done on your son or daughter. It's just a tool to help us as transplant physicians and as oncologists determine if we feel that this child is ready to go to transplant. But it's one thing that we consider. I said that the in one of my earlier questions or answers, I stated that you want to have 2 feet on the ground to go into transplant. One foot being a low enough, a good disease status, a low enough tumor burden. The other foot being good organ function. So Curie score is one of those fingers that we look at to evaluate disease status. And here's what it means in English. A Curie score is based off an MIBG scan. Every patient going through neuroblastoma therapy at some point has had an MIBG scan. 90% plus of patients at the time of diagnosis will have tumor that actually lights up on an MIBG scan. The way a Curie score works is that we'll divide the body into 10 segments. At least this is how we do it in North America. We'll divide the body into 10 segments. 9 segments are different skeletal regions, and 1 segment is what we call soft tissue or organ involvement. And then we'll actually look to see how much lights up on the MIBG scan in every one of those 10 segments. We give the scores for each segment 0 to 3. 3 being basically the entire segment all lights up with disease in it. 0 being nothing lights up. So let's say the head. So we look at the head as one segment, your skull. If there's one spot on the cheekbone that lights up, it would be a score of 1. If the entire skull lights up, that'd be a score of 3. What am I walking you through? Well, I'm walking you through how we do Curie scoring. We'll divide the body into these 10 segments. We'll score each segment 0 to 3. And thus, if you do the quick math, if you have tumor in every single segment, the highest score you can be is a 30. And if you're in complete remission, then every segment is a 0 and your score is a 0. The typical patient at the time of diagnosis will have scores of 15, 20, 25, 28 per se. I do look at the score at the time of diagnosis. A lot of parents will drop their head or drop their eyes, think, oh, geez, my son has a Curie score of 23 at diagnosis. That to me isn't as important as what's the Curie score at the end of that 5 rounds of induction therapy, that first cassette of therapy. So it's not so much the Curie score you have at the time of diagnosis that matters. It's the Curie score that you have as a measure of how well your tumor has responded to your initial 5 rounds of induction therapy that matters. There's been multiple reports on what that level should be. And every physician will actually have a different cutoff in their mind. Our own group here at the University of Michigan and within the Children's Oncology Group published back in, I think it was initially back in 2012. We actually published the efficacy or the role of Curie scores in single transplants. So if you're just doing one transplant. And with that, the optimal Curie score was a Curie score of 2 or less. So that you wanted to go into a single transplant with a Curie score of 2 or less. We then validated that in a large European trial and published this in 2018. Again, that a Curie score of 2 or less at the time of transplant was optimal for having a good response. Meaning you've now gone through induction therapy, you started with a score of 15, 20, 29, 30, whatever, and did you get down to 2 or less prior to transplant? And that's what a lot of parents hear. We want to get down to a score of 2 or less. For full disclosure for parents listening to this talk, all that work, our first publication, and then our second one that validated in 2018, was done with single transplants. My good friend and colleague, Carrie Strebe at Ohio State, and we just published recently in 2023, the optimal Curie score in tandem transplants. We're now doing tandem transplants pretty uniformly for patients, at least within North America. For patients who have tandem transplants, the optimal Curie score going into transplant isn't a Curie score of 2 or less. It's 0. In fact, you don't even need to do a score. You just look to see if the scan's still positive or not. Okay. I don't want to oversell the data to you as parents. If your son or daughter doesn't have a Curie score of 0 at the end of induction therapy, it's not like they shouldn't undergo transplant.